more than 200 qualified medical interns who graduated in March and April are awaiting placement for mandatory internship at public health facilities. The timing of unplaced medical interns couldn't have come at a worse time for South Africa, as it is buckling under the pressure of a third wave of COVID-19 infections. And joining me now to talk more on this is Youth and Career Development Manager at Solidarity, Paul Maritz, and one of the doctors who are waiting to be placed, Thamsanqa Sisobo, is on the line. And also on the line we have an intern who asked to remain anonymous, and for purposes of this conversation we have decided to name her Dr. Suzanne. Good evening to you all, and thank you so much for your time tonight. I'd like to begin with you, Dr. Suzanne, as we have resolved we're going to call you on the show so that we do protect your identity. Talk to us then about your journey, as you're telling us that you are still waiting to be placed.
Hi there. Thanks so much for having us on the show tonight. So I completed my medical internship at the end of April this year. And I don't know if you're familiar with the way in which the application and the placements work for medical interns and community service doctors, but it's a biannual placement that occurs in January up until April, and then July/August. So due to my internship only finishing at the end of April, I was then second rounded to the mid-cycle, which is now allegedly supposed to be commencing on the 1st of July. So yeah, we've been receiving communications, very poor communications, stating that we are meant to start our duties on the 1st of July, and to date no one has received any such placement, and it could be anywhere in the country. So it's a very troubling time, and in my position specifically, there are 167 of us awaiting community service placement, and the medical interns, there are about 294 waiting medical internship placement.
Dr. Sisobo, for someone who's not particularly familiar with this particular, program of internship placements, talk to us then about how critical it is in order to ensure that you then get to practice as a doctor.
Good evening to you and your viewers. I would just like to highlight the fact that for us as the new interns who haven't been placed yet, it's quite a traumatic and daunting experience to actually go through right now, as we have been anxiously waiting to find out when we will be able to start working. And as you know, that to progress through the medical ladder, you need to actually go through your internship and go through your ComCert. And so us not having been able to be placed and therefore commence our internship time, it really puts us in a very obscure position, as now we are anxiously waiting that we'll be called at some point and then given the opportunity to actually start our internship. So it's not really the best of experiences we're having right now.
And Paul, it sounds like, as we are nearing the 1st of July, as Dr. Suzanne has said, that she hasn't even received any information of where she's likely to be placed for the second phase. Can you talk to us then about what are some of the complaints that you are hearing from some of, these doctors that are yet to be placed? And are you also getting some of the shared sentiments from the two that we have just spoken to?
Yeah, definitely. I think my heart goes out to Dr. Suzanne and Dr. Sisobo. I mean, they've worked very, very hard at school to get selected to go and study medical sciences. And then they worked 6 years very, very hard. They gave hours after hours after hours for this country and for the job that they want to do. And this is the way in which they are being treated. In 6 days, they can be placed anywhere in the country at a moment's notice. And you know what the problem is it keeps happening every 6 months. It is biannually, as Dr. Suzanne had said, but the thing is, every single cycle we have this problem. And now they're telling us no, but the 288 posts couldn't be funded, or 213 of them couldn't be funded. How on earth do you know 6.5 years in advance that you're going to have these people and yet not fund their positions? And even, yes, I realize we're in a pandemic, but those funds are ring-fenced and can't be touched. And now national government says no, but it's the provincial governments that are supposed to have the funding. That's not a good enough answer. These are young people with very scarce qualifications. In South Africa, we have less than one doctor for every 1,000 people. That is half the global average. In Austria, you're looking at 5 doctors per 1,000 people. We really need these people to start working. You cannot allow slip-ups like this every 6 months. Now, the typical challenges that we have are right through. I mean, people who were selected to go and study medical sciences, then got there, then their names weren't on the list. Or people who aren't placed, which is what we're struggling with now. Or people who are placed and then arrive at the hospital or the clinic, but there's no job for them. So they literally sit on their hands for a month or two. These are problems that we struggle with every 6 months. Solidarity Youth has been struggling with this for 42 months now, where there's been at least one case not stable. Last year we went to court, and now obviously the same thing has just happened. We haven't received answers from Monday. We keep asking every day, and yet we're being ignored. This is more than vexing. This is more than irritating. This is a crisis, and something needs to be done urgently. What we propose is that the private sector come to the table, but perhaps we can discuss that more.
And Dr. Suzanne, let's then come to you. Certainly, you know, this is not a new problem. And when one goes back in time, we'd remember then when even Dr. Aaron Motsoaledi was still health minister in 2017, we were back here again. And there was even a time when he was saying that, you know, some of these interns do not want to be placed because they might be placed in rural hospitals, and this may not be their preference. Could that be the situation at play right now? And if you were to be placed in a rural hospital, are you willing to go there?
Firstly, that's really not true. At this point in this situation, we haven't even been given the opportunity to accept or reject the placement because we haven't been given any option at all. And yes, there are obviously people have preferences. A lot of people have families. They have kids in school, so everyone's social circumstance is different. But in the event, personally myself, I'm willing to work anywhere as long as I get a post. The financial implications of not having a job is also very difficult. So I think people are willing, and I speak for my colleagues as well, we're willing to up and leave, even if it is in a mere 6 days, purely to help and serve, because that's what we've been trained to do, and what a waste of our skill if not. And also with regards to medical interns, for ComServe, we are full-fledged doctors. We can work unsupervised, not necessarily in the same position as interns. And for interns, unfortunately, they cannot work in the rural community health centers because they need to be in an institute that is accredited by the Department of Health. And those are generally more central hospitals. So it's not a matter of them choosing to not want to work in rural areas. They actually cannot because they're not accredited.
And Dr. Sisobo, let's look at the situation the country finds itself in. We are in a third wave of the COVID-19 pandemic. Some hospitals, you know, are buckling under pressure. And some doctors have fatigue. They simply cannot continue. Rosters are really becoming difficult to adhere to at this time, as a lot of them are working long hours. How does that make you feel, knowing that you are staying at home and you could be out there making a difference?
Thank you for asking the question. So it makes us feel a bit anxious because we are ready, all 288 of the interns, well, the 293, I think, at this point now, because there's 3 more people who joined in. All of us are ready to actually work and assist wherever we can. And we have heard from our colleagues who are actually interns currently about how exhausting and how exhausted they are now, because they've already been through 2 waves, and this is the 3rd wave. And obviously around this time hospitals are quite full and therefore require a bit more hands to actually get through the day. And so we are actually saying we are ready to the government, and so it makes us feel hopeless and a little bit sad to know that we are ready. We've been trained by universities, and therefore we are ready to sort of join in the workforce and be in the front line, but we are not then being afforded that opportunity at this point. And we're really hoping that today the government or the health department actually communicates with us and tells us exactly what we had hoped they were going to tell us, which is to place us, because we know that right now there's about 4 more days to go before the 1st of July. And it leaves us in limbo because we're not really sure of whether we are going to start working on the 1st of July, and if that's the case, how are we then going to move around and get to the respective hospitals that we were supposed to go to. And to also reiterate the point that is made by my colleague here about us refusing to work at rural hospitals, that's not the case. Most of us, or some of us at least, are from rural areas anyway. And so when we started doing medicine, we knew exactly the kind of communities that we came from. And we went there with the hope that one day we'll come back to the communities and actually contribute to the health system in those respective communities. And to find out that we are not being afforded opportunities is quite disheartening. And especially now that we know that people who are actually working currently are actually exhausted and they are tired, and we feel like we can contribute at least.
And Paul, certainly when you're listening to both of them, it does sound like they are ready to be placed in hospitals and actually, hit the ground running. The department says that this, due to the pandemic, institutions have extended their academic year, and this has been a result of the delay. What happens now, from your end, in order to ensure that some of these doctors are then placed, or if not all of them? What are you going to do in order to try and force the hand of government here?
All right, so at this stage we can do nothing but send letters and sort of threaten, and then on the 2nd of July, if there are some young doctors that are still not placed, then we can start speaking to courts, because then essentially these people have to be placed, and we can say that there's damage. But what I think is that essentially we're going to have this problem every 6 months. Funding is going to continue being a problem. Now, at Solidarity, we frequently speak about what we call the golden triangle. So you have the government, you have the community, and then you also have private business. And what we're proposing is that in the future, we should allow private hospital groups to also take part in training these interns. In the case of pharmaceutical students, we know that certain pharmacies can be registered as training pharmacies, and then you can get interns and take them for their 1-year internship before they go and do their ComServe. And what we're proposing is that private hospital groups be allowed to enter this, and then we can say if there's a problem in funding, then at least the private sector can pick up some of the slack. Why do we say that? Because we have too few doctors in this country. I've given you the statistics, and all we're saying is this problem needs to be solved. And obviously, at this stage, the government isn't able to do it. Now, we can point fingers, but essentially we're going to have to come to the table with a solution. And the solution that we're saying is that we have a world-class private medical sector, along with the world-class education sector. Why not allow these two to gel as they are doing with pharmaceutical students, and in that way have a sustainable future where no doctors need to be in the same limbo that these two doctors that are with me on the panel are at this stage. Essentially, I think it's a shame. And for them, yes, I can hear their sentiments, and that's wonderful, and I want to applaud them for that by saying that they really just want to serve. And that's fine, and that's wonderful, but still, this government should have treated them better. Just because they are willing to suck it up doesn't mean they should be forced to suck it up, and the generations of doctors to come should be forced to suck it up. There are solutions. They're right in front of us. Let's take those solutions and essentially make this country better.
And Paul, I tell you what, we'll touch base with you on the 2nd to see if there's been any success, or if now this matter is going to be headed then to the courts. Thank you so much to you all for your time, and certainly we wish you all the best as you try to then get those placements, and as you say then that you are hoping to make some kind of a difference, particularly when you speak to some of your colleagues then who are telling you that they actually are exhausted as the country battles the surge in COVID-19 cases. Thank you so much for your time to all of you. That was Paul Maritz of Solidarity, and qualified medical interns Thamsanqa Sisobo, as well as, for purposes of this discussion, we called her Dr. Suzanne.